Skin cancer affects people of all races and is actually the most common form of cancer in the United States. In looking for those bronze glows, many people endanger their health and their lives by exposing themselves to harmful rays. Dr. Zheng Topp joins us now to discuss prevention and treatment of this disease. Dr. Topp, thank you so much for coming on today.
Thank you for having me.
To get started, share a little about yourself and your experience as an oncologist.
Well, I actually grew up in the South. I'm from Mississippi, and did most of my training in the South. But I did do part of my training in Virginia, and I did my fellowship in San Diego. So, coming back to Pensacola is coming back to home for us essentially. But I had kind of stumbled into it in medical school and did a rotation in oncology, just fell in love with the patients. And it's been very rewarding since then.
Gotcha. Obviously, summer is upon us,
Yes.
and a lot of people want to get out there and lay in the sun and tan, but I understand that skin cancer can be a real threat. Tell us about the cancer screening process and what parts of the body are screened.
A medical professional will examine the skin, looking for any areas that look suspicious or of concern. When possible, a full body examination is recommended. In public places, obviously, I think only exposed areas are examined. And that's a very good way to make sure that we stay on top of lesions that maybe turn into cancer or are cancerous that can be treated early.
Okay. And who should get screened, and how often should they get screened?
So it's controversial in some ways, and I think depending on who you ask, people feel differently about it. But in general, what we say is anyone over the age of 30, okay. Anyone with a history of being immunocompromised, be it an illness or even another cancer, for example, people with a personal history of skin cancers, and also patients, people who have a family member, a first-degree relative with a history of melanoma. And in general, we recommend at least once a year a full body examination.
Okay. Walk us through that process. How do you get tested for skin cancer?
Well, unfortunately, there's not a blood test or anything, but in general, I think you'll be seen by a medical professional, and they will examine your skin in detail, looking for any spots, and if there may be an area that may be suspicious or of concern, then maybe possibly skin scrapings will be done. Otherwise, a biopsy may be done as well, and then tested under a microscope and examined by a pathologist.
What are some of the signs that we can look for that might show us that we have skin cancer? What do those signs look like?
So a spot that looks different than it was before. There are the most common skin cancers we see are basal cell and squamous cell. Basal cells tend to be a pearly bump. Actually, let me preface this by saying skin cancers can do whatever it wants, so sometimes it does not exactly follow the rules. Okay. So a pearly bump is a basal cell usually. Squamous cell cancers tend to be, kind of a dry patchy area, a reddish area, a sore that heals and then reopens, or the reasons to see your dermatologist about those. Melanoma is what we are all most scared of. Mm-hmm. There is the ABCDE rules of looking for melanoma, looking for a mole that has asymmetry, irregular borders, color changes, and diameter, meaning that a large enlarging mole, and any lesions that is evolving and different from others. Melanomas can be pigmented, can be non-pigmented.
Okay. How do we prevent skin cancer from occurring in the first place?
Excellent question. I think prevention is really the key and the goal. So we live in sunny Florida, mm-hmm. So it's definitely hard to avoid the sun entirely, and we don't necessarily want to do that. Mm-hmm. But the recommendation is to really try to avoid the sun as much as possible between the hours of 10 and 2 to 3, okay. When the sun's rays are the strongest. Wear protective clothing. Wear sunscreen, even on cloudy days. And I usually, for myself and my children, we use at least SPF 30.
Okay.
And then also, be really, every 2 hours or when you're wet and sweating, reapply sunscreen. And then notice that if you're around, sand and water, they tend to reflect the rays more. So just be aware of that and be cautious of that. And also avoid tanning beds, if possible.
Okay.
So those are the kind of the rules that I go by and I recommend to my patients.
Sure. Now, in the unfortunate situation that someone, does have skin cancer, what does treatment of that look like?
So majority of skin cancers are cured,
Okay.
like basal cells and squamous cells, just by excision. Melanomas can be cured just by excision if it's caught early enough. And then really what we're scared about are melanomas and Merkel cells. They tend to be more aggressive and harder to treat. So in those instances, sometimes there would be more surgery involved. Sometimes we would talk about immunotherapy or radiation. Less now, chemotherapy could be used as well, but mostly those along those lines. But again, the majority of skin cancers, if caught early enough, are cured.
Yeah, that's encouraging.
Yes.
So how do you detect the skin cancer?
So what the dermatologist would do would look for any suspicious lesions, and they would excise it, look it under the microscope, and the pathologist would be able to confirm what type it is, and depending what that is, we would go forth with how to proceed. Again, most of the time, simple excision, you're cured.
Okay. Now, I understand that there's an upcoming screening in July. How can the community participate in that?
Yes, the Baptist Cancer Institute will be hosting a free skin cancer screening at the Blue Angels Air Show in July, July 7th. It's a Friday, the practice show. It starts at 8, lasts until noon at Casino Beach. Okay. And anyone's welcome to come. There's no reservations needed. There'll be dermatologists there, there'll be drinks there, and I think sunscreen there as well.
Right.
So, so come on by.
And that's free?
Absolutely.
Okay, so while people are out there in the sun,
perfect
they
place.
They can get tested. Fantastic.
Yep.
Tell us about some of the other resources available at Baptist and how we can get help.
If a person is diagnosed with cancer, in general, if a question about skin cancer, they can call the Cancer Support Services. The number is 850-469-7462.
Okay.
And then, I mean, if just really any questions or concerns, there's educational materials we can provide. And we have support services who are very good about navigating and directing people and patients with questions to the right places.
Awesome, awesome. Well, it's a very important topic, especially in the summer, especially in Florida, and I hope people will take some of those preventative measures that you outlined. Thank you so much for coming on and discussing this with us, Dr. Topp.
Thank you so much.